Sometimes technology is great. Other times you get surgery by a robot and it nearly ruins your mouth.
I started losing lots of my teeth a couple years ago. Every year, one or two would come out. Well, about 6 years ago, went to a dentist, took x-rays. He told me, you know what, you got lots of bone loss, that in the future my teeth were eventually all gonna come out.
Yeah, lovely gentleman, Jose. He actually came in to see us about a year ago, and due to cost, he decided to go somewhere else, get a second opinion somewhere else. And he was really, really intrigued by the place he went to after us because they offered a robot to do surgery for him.
So a robot performed surgery on you?
Yeah, with the dentist there by the, yeah, it's like a little arm thing that comes out and yeah, he starts taking out all your teeth, I guess. I don't know. Right there and then, should have been a red flag. I should have backed out. I mean, yeah, I was already nervous about the whole thing. I wasn't looking at my health. Instead, I was looking at money. I was more interested in, in the cost. I found that place out there and they were like half the price.
So he went through with the procedure with the place that offered the robot. And unfortunately, things did not turn out well.
It took him 6 hours. Surgery took a long time. I'm gonna say about 2 weeks later, 2.5 weeks later, the upper part of my jaw, one of the implants came loose. They tell me, hey, it came loose, it's not gonna work, it failed.
His implants were coming out of his mouth very quickly afterward. Like it happened multiple times.
Come back 2 weeks later, find out he got another infection, another one came loose, the bottom. During the consultation, when they told me that I had a bunch of bone loss to the upper part of my jaw, I asked them about my lower part of my jaw. They said the lower part of your jaw is good. Nothing is gonna go wrong there. But yet, something did go wrong. Another implant came out. Then I got a real bad infection, real bad.
There was significant infection as well on the upper implants, on the lower implants. I mean, they just came out like with my fingers. They were just not integrated at all. It was pretty awful.
So I came to Dental Implants GPS. They take x-rays, they do 3D scans. Dr. Baker, he starts to explain to me how the implant surgery there at that other place, that sedation and implants, was a failure. That eventually they're all gonna come out.
When we got a CT scan, sure enough, it was all failing on the bottom too. The implants that were supposed to be healing on the top were all failing. The implants with the teeth on them on the bottom were failing. In fact, when I took off the lower teeth, the implants just came with the teeth out of his mouth. The bone didn't fuse to the implants at all.
Anytime we take out an implant, there's a risk that it's going to take some of the bone with it because it kind of fuses to the bone. And we obviously want to be as minimally invasive as we can. I don't want to remove any of the bone. We use a special system that will just back the implant out. We'll just reverse it so that it's not damaging any of the bone. Well, that wasn't hard. You can see the screws right here. Mm-hmm. They're supposed to be screwed in, but those are unscrewed.
So you literally were able to just pull it off?
Yep.
I'm looking forward to getting my life back, pretty much. And I believe this is where it's at GPS.
This kind of surgery is the smallest surgery we do. As opposed to if you saw a general dentist, this is like pushing the limits of their capability. You never want your surgeon to push the limits of their capability. You want a surgeon that can do things that are significantly more advanced and challenging than what they're doing on you.
So fortunately, we were able to get all the infection out, get all the old, failing implants out, get brand new implants in there that are sterile and healthy and good, healthy bone, great stability. Everything turned out fantastic. He's gonna leave our office with new teeth. So those teeth will be connected to those implants and he'll walk out and never have a denture again, never have a removable piece in his mouth again. He'll have fixed teeth for the rest of his life. And that's a pretty special thing.
Excited? Excited?
We're excited for you too.
Mm-hmm. Okay, here it goes. The transformation. Oh, yeah.
I can help you out.
There you go.
I know you're not.
Nice. Look at that.
There you go.
Ah. What a difference. And just the whole feel of it is different. Wow. Amazing job. Amazing job, guys.
Oh, yeah.
I'll get a bump.
My friend.
I'll get a bump.
Yeah.
I'll get a bump.
Congratulations. We're so happy
Thank you.
for
What do you think, robot or real?
Oh,
surgeon?
man. You know what?
Real.
I don't know. That robot, I don't even know what I'm going to do with that robot, Joe.
I may come off egotistical, but I don't know why you would want to have a robot place your implant instead of a surgeon who has lots of experience. And I think that's really where the failing can come in, is a tool is only as good as the person that's operating the tool. And so while a robot can maybe place the implant nice and straight, who's operating the robot? And do they really know what they're doing? Implants from 30 years ago, 90% of them are still successful, still in the mouth of patients. So no robots were used back then.
Oh, look at that.
Yeah, that's a
Man. Okay.
Yeah.
So if you're considering having a robot do your dental implants, you may want to think again. You may want to choose an oral and maxillofacial surgeon, and we're happy to be your second opinion there to weigh in. We have a free checklist that you can find in the link below. Please click on it and it'll give you the information you should be asking your surgeon, or maybe in this case your robot.